Hi there, welcome to Ask Amy. Good to see you guys again this week. Last time we talked about the phone call and kind of covered the basics, covered your script and all those good things. This is sort of a continuation of that discussion, and I promise you we talk about how to handle new patients over the phone and how to take care of them as far as insurance things that may come up over the phone. These are two things that are kind of thorns in our side a little bit, but as we understand more where your patient's coming from and really seek to understand them and be more on their level, I think you guys will have a lot more success here. As we go back, and I talked last time a little bit about these secret shopper calls that we do periodically, one of the things that we noticed was with emergency patients that had a toothache or something bothering them, we kind of get an autopilot. We go through and ask these questions, where is it, upper right, lower right, blah, blah, blah. Is it sensitive to hot and cold? Is it keeping you up at night? Are you taking anything for it? We go through and ask those questions, and I'm not really even sure we do anything with that information. I don't know about you guys, but that's just something we've always asked. But when they actually came in, I mean, yeah, naturally we want to know where it is, but can't we find that out when they come in? I mean, I don't know. I think it's kind of irrelevant in the phone call. In the phone call, when you've got an emergency, a patient who's having a toothache and they're really in pain or uncomfortable, let's show some empathy. I think we get, again, an autopilot, and how many times a day do we hear, I have a toothache? We almost become immune to that as far as, the human side of us and really feeling for them. So, gosh, let them know, I am so sorry that you're having to go through this. What a bad deal. Gosh, we want to help you and get you comfortable. By all means, we would love to be able to do that for you. Let them know that you care about what they're going through. Because, again, we hear that several times a day. They have a toothache how often in their lives? Most people not too much. So it's a big deal to them. It's a big deal. So show empathy. It took them a ton of courage to pick up the phone and call you. A lot of our toothache patients are people who don't frequent the dentist a whole lot, and it's probably a fear issue. Not always, but it could be. So, keep that in mind. Keep that in mind. I would let them know too, we have a special time just for our emergency patients, and we could see you today at 1:30. Again, going back to the system with your schedule, you ought to have those emergency times blocked right after lunch. Remember, that's not a time to do treatment. It's a time to evaluate what's going on, get them out of pain if needed, which is not going to be an emergency root canal and crown prep. It's just what you need to get them comfortable. Many times an emergency is not pain related. It could be a broken tooth, it could be something that isn't really symptomatic at this point in time, and may not require any treatment. It's just an evaluation. They may want to know, are you going to be able to fix my tooth today? I would respond by letting them know we will do everything we need to do to get you comfortable, again, if they're experiencing pain. And when you come in, we will get with you and come up with a plan to work towards the appropriate solution for that tooth based on what you're wanting long term. All right. Cost. Again, as we talked about last time, I would make it one fee for your emergency visits regardless. I don't think it really matters a whole lot what it is, $75, $100, whatever. We even have some practices who don't charge for emergency visits for new patients. And again, this is just to evaluate what's going on. I kind of equate it a little bit to discount tire. I hate car analogies because I don't understand cars, but I understand this. A couple of years ago, I had a new vehicle, had it 6 days, drove through the Walmart parking lot, hit a screw, and had a flat tire. I went to Discount Tire. They patched it up, they fixed it for me, and told me, no charge. We just look forward to seeing you when you need new tires. I thought, how cool is that? And so I think you can take that approach, but if you're going to charge for your emergency visits, make sure it's just a simple, one fee, regardless of what you do. I know, too, that you guys many times have patients who might say, I just want to get it pulled. Okay, I just take the tooth out. Well, if they're in pain, they're probably not thinking real rationally. They just want to get the source of the pain out. I would not use this phone call as a time to educate them as to what's going to happen if they pull the tooth, and how they're going to, all those things that happen, and how they're going to have problems if they don't, replace the tooth, and so on and so forth. We understand that and we know that, but I don't think the phone call is the time to educate them about that. I think you might ask more questions. Tell me why you want to have the tooth taken out. Well, it hurts. Okay, other than that, is there any particular reason? There are lots of resources and things available to us today that weren't a few years ago that will allow you to save your teeth. You might be interested in, hearing about that. So again, don't take that time to educate them. Let's get them in the door. They are probably scared. They may be in pain. Maybe that's what their parents chose and they just assume that's the only option. So don't prejudge them or take that time to educate them. Again, show compassion, show empathy. Just by asking how long has it been hurting, that is not sympathetic, okay? So don't think you're being sympathetic by asking that question. Let them know you genuinely care, all right? Again, emergencies, let's not use that as a time to treat them necessarily. It's a time to evaluate the situation. Then we present treatment to either get them back for a planning appointment in many cases, or if it's a little more urgent than that, we get them back on the schedule in the morning at a time that's blocked where you can give them their, the undivided attention that they deserve. All right. Now, moving on to insurance. And I'm not going to spend a lot of time on this because I really don't want you to spend a lot of time discussing insurance with your patients over the phone. Again, it doesn't matter if you are a full-fledged PPO managed care practice or don't take insurance at all. None of that matters. What matters is how you handle it over the phone. So if a patient calls you and they want to know, do you take my insurance? Again, we're not going to go there until they do. Let them know, hey, yes, we are insurance friendly. We work with all insurance companies that work with us. We're not insurance dependent. As far as you're communicating that. If they want to know, are you on my list? Are you a preferred provider? And by the way, I don't like that term. I don't think we should use it. If you're not a preferred provider, then what are you? Not preferred? I don't get that. That's just something the insurance companies made up to make non-providers look bad. So don't even use that terminology, but they might. And let them know. You won't find us on the restricted list, but you know what? We have a lot of patients with that same insurance, and we'd love to have you. Just don't get into it. Simplify. Don't arm wrestle with them about their insurance over the phone. Again, I think as far as the new patient phone call, less is more when it comes to insurance. One more thing. Let's talk about your away message. Whether it's answered during the day when you're there assisting patients or at night. I would probably, if you haven't in a while, call the office and listen to that. See what your patients are hearing. I think some of us might be surprised at how it's being perceived. Keep the message short. They don't want to sit on the phone and listen to a ton of options or all the different hours you work. In fact, I wouldn't even leave your hours on there. They'll wonder why you're never there. Especially if you've been with us a while, you're taking some time off, aren't you? So don't worry about that part. Just indicate when you're going to be back, the date and the time that you will be back in the office, and that you will, look forward to returning their call at that point in time. Let them know if you're a new patient, we can't wait to meet you. Feel free to visit our website or go to our Facebook page to learn, more about what our patients are saying about us. Don't leave any policy information on your message about cancellations or whatever. If you feel the need to do that, I would just invite them to call your doctor at home if they need to change an appointment. I heard one the other day, and they had kind of taken this from a practice we worked with a long time ago. They said, any changes in your appointment affect many people, but if you feel the need to make a change, you can reach our doctor at home at blah, 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 blah. They're not going to call him at home to change an appointment. In fact, I think it's probably a good idea that you don't take messages. Just let them know if you have questions regarding anything or want to schedule an appointment. We look forward to talking to you. Call us back tomorrow morning at 8 o'clock. Okay. I would have a separate message during the day that lets them know, hey, we are in the office today and the date. We're currently helping another patient get what's important to them, but we can't wait to talk with you. If you'll leave your information, please do so, and we will get back to you within an hour. And again, if you're a new patient, we can't wait to meet you and have you in our practice as well. So again, simple, less is more. Your tone of voice is important, even on these messages, all right? Okay, that's it. It's good to be with you guys again, and I'd like you to stay tuned because next time we're going to talk about how much dentistry you might be giving away. All right, so I'll look forward to talking with you then.